It's 1:15, wherever you are in the country. Um, and so our next round of speakers are Gordon Fogg and Dr. Karen Harkness talking about Movin and Groovin, exercise prescription in patients with heart failure at home. I'm just going to give an introduction here. Gordon Fogg is a cardiac rehab program lead and kinesiologist and certified exercise professional at the Refit Center. And his primary goal is to enhance human performance at all stages of life, predominantly by managing lifestyle and chronic diseases through evidence-based activity prescription, facilitated lifestyle change, and community development. He is very passionate about cardiovascular prevention, heart failure, and adult congenital heart disease. But what's really additionally cool about Gord is that he builds houses and robots on the side. And Dr. Karen Harkness, who I've known for quite some time, has been a cardiovascular nurse for over 30 years. Currently, Dr. Harkness is a clinical strategist and subject matter expert for heart failure at Core Health Ontario, formerly known as the Cardiac Care Network. And this role includes engaging key stakeholders from clinical, research, and administrative positions to help inform and improve health system design and patient-centered care in Ontario. And I know from personal experience, through the HeartLife Foundation, Karen is an incredible advocate for patients and the patient voice in Canada. And I'm really excited to hear what her and Gord have to share. Just some quick housekeeping. Next slide, please. Just to remind everybody who's just joining us. To submit your questions, please use the Q&A button down at the bottom of your screen, and we will keep track of those. Also, you are in audio only mode, so you can hear us and you can see our video, but we can't see or hear you. So the Q&A is really kind of the only way that we know you're out there, but also we are on social media at #HeartLifeDay, and you can follow us at HeartLife Canada. Next slide, please. And I will hand it over to Gordon and Dr. Harkness.
Thank you, Jillian, and thank you for HeartLife for this opportunity to share. We're really looking forward to trying to help support your journey with heart failure. And so I'm going to start off a little bit, and then Gord is going to get into the full thickness of the physical activity and exercise. So next slide, please. Okay, so these are, if you ever read a book and you go to the last page, this is the last page of the book. That we do have some really key points, but how do we get there? And so we're going to talk a little bit more about how exercise can be safe, knowing your body and your environment, and really looking for things that you enjoy doing. Because if you enjoy them, you will keep them going. Okay, next slide then, please. So in the bigger picture, we're going to talk about exercise, but if we take a step back, we talk about being a partner in managing heart failure, and that boils down to what we call self-care. And there's 3 large components of self-care. There's the first part about maintenance, which really talks about how do I help feel well and keep my heart failure from getting worse. So that really is about maintaining health. Then there's the part about monitoring, where we talk about what are my symptoms and are they different from day to day, and what do I need to do about that? And then there's also the plan, the action plans, if there has been a change. We're not going to concentrate on all of these. We're really going to focus in on the exercise. As you know, there are managed. Next slide. So this, you may have seen this, and Gord may talk a little bit about heart failure zones. So I wanted to point this out ahead of time, but this is a great tool for just doing a check each day. How are you doing in the sense of your heart failure? Are things going well? Or do you have a little bit of concern that things might be changing, and then developing an action plan? So when we talk about exercise and what are your zones, please keep in mind, are you in the green or the yellow zone? Because that may affect how you choose to exercise that day. And obviously the red zone is a whole different ballgame. Next slide. So when we look specifically at heart failure and self-care maintenance, some of the things that you need to do each day to stay healthy are pretty common, whether you have heart failure or not, except for all those darn medications and organizing them. And the idea of eating well, of not smoking, and regular exercise. And regular exercise is important for everybody, regardless of whether you have heart failure or not. But it does get a little bit tricky when you want to pay attention to the status of your heart failure. And so that's where Gord will really take us into some additional information. The next slide. Thank you. So we know at the end of the day, whether you have heart failure or not, exercise is important. But what about if you do have heart failure? It really does improve your quality of life. It does help improve your symptoms of heart failure. And it does make it easier for the heart to work. Some people will ask, I've heard the word ejection fraction. Does exercise make my ejection fraction better? Not directly. But if the rest of your body doesn't have to work as hard to exercise, it makes things much easier for the heart. So your lungs are more efficient, your muscles are more efficient, your blood flow is more efficient. You will feel better regardless of that ejection fraction. So on that note, I'm going to actually turn things over to Gord, who is the expert and looking at some exercise and physical activity in the setting of heart failure.
Thanks so much, Karen. So usually when we start any discussion of exercise or physical activity, we like to try to define and differentiate them a little bit. It's not uncommon for people who may already be doing lots of physical activity to not really think that they exercise or to feel uncomfortable with exercise. Likewise, some folks may be doing some very small amounts of physical activity and think that they're maybe exercising enough when there may be some additional benefit to exercising a little bit more. So physical activity is really any waking activity that involves your muscles. It increases your metabolic activity and consumption of oxygen. Basically, it's just any sort of movement. Exercise typically is a more structured and planned activity. It's something that you do very intentionally and is usually a little bit more intense than something that's just sort of light activity like getting dressed or getting up to get a drink of water. Next slide, please. And then when we do start talking about exercise, one of the most common questions that people get if they're newer to exercise, and I am kind of speaking mostly to folks who are newer to exercise through the slideshow. If you're more experienced with exercise, feel free to ask questions and I'll try to answer them at the end. But is exercise safe is one of the more common questions that we get. And there's a well-established body of evidence, even in the heart failure population. There was a large randomized controlled trial called HF Action, which demonstrated that exercise is in fact generally a very safe activity and it does have benefits for heart failure patients. There are some situations though where exercise may not be safe in kind of the short term. So it's important that you do, know your body and your conditions, speak with your healthcare provider, and make sure that there aren't any conditions that you have that would require you to limit the intensity or how hard you're working, or where you might be restricted from doing particular types of exercises. Another couple of quick notes. Some exceptions to exercise being generally very safe. If your symptoms are worsening, as Karen mentioned with the zones, it's important to kind of pay attention to daily weights, how you're feeling, things like that. And if that's getting worse over time, don't try to resolve that with exercise. It's more important that you speak with your doctor, identify what's going on, and take the steps necessary to make sure you're in good health before resuming exercise. And if exercise aggravates any symptoms you have, then definitely it's important to talk pretty quickly to your care team. If you're doing some exercise and there's a sudden onset of symptoms that don't go away with rest, then it may even be an emergency and time to call 911. But those events are typically pretty uncommon, and again, for the most part, for most people, even with heart failure, exercise is safe and very beneficial. Next slide. So this is where we start talking a little bit about how do I know how hard to push? And the evidence is pretty clear. We do need some element of pushing a little bit or working a little bit harder than just light activity to really start accruing significant health benefits. And you know, whatever, I work in cardiac rehab, I even do our home-based program, and we don't always have a whole bunch of wires hooked up to people. That's kind of unreasonable, and it puts up some barriers. So we like to use something called the talk test, or a rating of perceived exertion scale. And to see the benefits of exercise, you really only need to be working somewhere in the range of 3 to 5 out of 10. Or working to the point where you can still carry on a conversation reasonably, perhaps, but you should still be working hard enough that you wouldn't be able to sing a song or orate loudly. So, you know, the symptoms of exercise are getting a little bit warmer, maybe kind of getting a bit of a glow on or sweating a little bit, breathing more heavily. We want you breathing heavily enough that you wouldn't be able to sing a song. If you get into the point where you're breathing so heavily that you are having to take a breath or gasp in the middle of sentences, then you know you may be doing more than you really need to in terms of intensity and pushing into the vigorous zone. In many cases, that may still be safe, but you don't have to work that hard to see a benefit. And depending on your health status, it may be slightly safer. There's more evidence of safety in the moderate intensity zone. So again, just pushing a little bit so you feel like you're working a little bit. Next slide. And as I kind of alluded to or just mentioned, moderate intensity has a well-established evidence base, even in the heart failure population. One of the major benefits is improving quality of life. That was one of the things that the HF Action trial found, and you know, can help to sort of improve health, reduce hospitalizations. But with one of the main benefits being improvement in quality of life, we don't want to really, if you have knee arthritis, for example, or chronic pain issues that are becoming aggravated and diminishing your quality of life, then we're kind of undoing a lot of the benefits of exercise. So again, we want you in the spot where you're working hard enough that over weeks and months, hopefully you're maintaining your level of energy or seeing some improvements there. But we don't need you to push too hard to the point where you're really wiped the next day or for the rest of the day, or you're getting aggravations of knee pain and arthritis. Really, it's kind of a matter of balancing caution and confidence. You know, we don't want you to be overly cautious and avoiding exercise, but also for some folks who just want to, you know, do extreme cycling in extreme heat at altitude and all kinds of crazy stuff like that. You know, that's taking on unnecessary risk and putting your body under unnecessary stress to see the health benefits of exercise. So things that aren't normal, again, would be any abnormal pains, sensations, or fatigues get worse with exercise. And you can usually either dial back the intensity or switch up the activities to find something that's more appropriate but still beneficial. Next slide. So, how do we do exercise? The guidelines are pretty clear. These are general guidelines for pretty much everybody, and they're reiterated in the Canadian Cardiovascular Society Heart Failure Guidelines. We like to set a target. This is an optimum of about 150 minutes per week. This doesn't have to be all done at once. In fact, we encourage you to break it up and not do it all at once. If you can do 10 minutes, great. If you can do 20 minutes, great. If you're just starting out and time is a big barrier for you, which it is commonly for a lot of people, the usual sort of rhetorical question that I offer that's half serious is, you know, quick show of hands, who's able to take 2 minutes out of the next week to devote to a little bit of physical activity? It sounds silly, but getting started with something that's very manageable and you know you can accomplish might be the best way to start generating some momentum. If you do more than that, great. But we want to set sort of the minimum level at an appropriate point where you know you can accomplish it and do so with confidence. And Exercise generally works best if we spread it out through the week, so usually around 3 to 5 days. Next slide. The guidelines also recommend the addition of resistance training, which is just doing, not so much 10 minutes of something, but a series of repetitions of an exercise, like bicep curls, where you're just basically bending and letting your elbow unbend while seated or standing. You can do this with any gear that you have at home, whether it's a dumbbell, a resistance tube, a can of soup. The elbow is a really simple joint. It just bends and it unbends. There's no rocket science to it, fortunately. And I mean, personally, this week, my gym I usually go to is closed. I worked out with some bags of dog food, honestly. So there's some room to get creative. Just make sure that if you're working out with fluids or something that can spill, that it's sealed and is not going to spill all over yourself. We also encourage people to do a variety of exercises to strengthen most muscles in your body. So some leg exercises, arm exercises, core, back, chest, things like that. And we'll give you some resources later on in the presentation where you can go to get some information, some videos or diagrams on how to do these exercises. And some additional things that you can do at home in the era of COVID. Next slide. Would be balance and flexibility training. So we definitely want to encourage this, help to maintain strength and your functional capacity. So your ability to just do the regular activities that you like to do, being able to carry groceries and things like that, climbing stairs, and just maintaining the strength of your muscles. As well, if you're somebody who worries about falls or avoids physical activity because things are icy out, particularly if you're spending a lot more time at home lately, it might be a good opportunity in a fairly safe environment to do some controlled balance exercises, like just practicing your balance while holding onto the kitchen counter or something like that. Next slide. So moving back to getting started with exercise, if you're newer to it, a lot of the language we're using is move more, sit less, or any is good and more is better. And we've kind of switched to that language from 150 minutes strictly because the 150 minutes is an optimum. It's not like the benefits of exercise only kick in at 150 minutes. And if you do 149, then you're not going to see anything good happen. Really, if you do 30 or 60 minutes in a week, that's fantastic. If you do 90 or 120, even better. And beyond 150 minutes, depending on who you are and how exercise impacts your particular risk factors or conditions, you might actually see diminishing returns and have to put in more effort to get smaller and smaller benefits, at the more extreme ends of exercise and physical activity. So the people who really see the most health benefit from exercise are the folks who go from doing very little and low fitness levels to doing a little bit, and often they can see pretty significant improvements in their functional capacity. So if you're sedentary, you don't need to worry about running a marathon. Just getting in a little bit of activity can have significant impacts on your health. And with heart failure as well, the guidelines are pretty clear. You can take rests as needed. And we always want you to progress gradually if you're just starting out. So if you're doing 10 minutes 3 times a week and you have to take a break midway through, awesome. That's a great place to start. Next slide. The next thing that people often sort of struggle with once they've made the decision to get going and kind of made that leap is building and maintaining motivation or a sense of confidence that they can do exercise. A couple of tools can help with this, like SMART goals and goal setting strategies. It's important to set goals that are SMART, so specific, measurable, attainable, realistic, and time-bound. And the reason for that is we want your goals to help give you some guidance in terms of what to do. And, that's the difference between, I'd like to get healthy. I should probably exercise this year. That can sometimes happen with the New Year's resolutions, and then motivation sort of fades. outcome goals are great, you know, the idea of losing a little bit of weight or something like that. But it is really helpful when you can set a more specific behavioral goal, like I'll go for a walk tomorrow, or I'm going to go for a 10-minute walk tomorrow. Gives you a time frame. You can test whether it was a realistic or an attainable goal. If you try 10 minutes and you're totally out of gas by the end of it, or you have to take a break, then maybe that wasn't an attainable goal, and 5 minutes is more of an appropriate goal. Realistic is important because these goals have to fit into your life. If you are very busy or you just don't enjoy a particular activity, then maybe it won't be as likely that you're going to stick with it. So it's important to find things that you enjoy or work into your routines well. You know, finding things that are close and convenient. As well, I skipped over the measurable. That can help you to see a sense of progress. So combining a measurable target with logging and keeping track of it, you know, as your 5 minutes turns into 10 minutes, turns into 15 minutes, you can start to see this trajectory and gradual progression where, you know, even on our bad days when we're kind of like a little bit down and, you know, it's not really doing anything. That's when we need those little bits of motivation and objective kind of reality checks that, you know, when we look back in time, we have seen a trajectory of getting a little bit better. So documenting those things can be great. Similarly, activity trackers can help to reduce sedentary time, where we're spending a lot of time, you know, with media, sitting around not moving very much. It can help you to set step targets, and at home, this is probably an important time to do that. Many people might not be getting many steps at all. If you're doing 200 steps a day, great. We have that information and you're doing something. We can use that 200 steps a day to set a goal of tomorrow, I'll try 300 steps, then 400 steps. Don't worry about the 10,000 target, not really super well based in evidence. And the important thing is to go with where are you right now and what can you do right now? How do we aim to progress a little bit further? Next slide. Another thing that we tend to shoot ourselves in the foot with is acknowledging, identifying, and celebrating our successes. We can be really hard on ourselves, and particularly if we've, you know, set goals that are maybe overly ambitious. Has anybody ever failed at anything before? How does that feel? If we're setting ourselves up to have negative associations with exercise, we're less likely to be able to maintain it. So it's important that we sort of set goals that are attainable and realistic, but also that when we start to accomplish these things, we really kind of let ourselves feel good about them. You know, I've seen some people where in a class we'll have somebody who was very active before and kind of a marathoner, and you know, they were really proud that they were starting to work back to that. But I've had some folks where, you know, they were stoked because they could get up a flight of stairs without, you know, experiencing breathlessness. And from my perspective, that's a much larger accomplishment than being able to run a marathon. That's for a lot of people, and you're way more aware of this than I am, something like that can be a huge improvement in quality of life, and that's a big win. So, you know, finding ways to tie physical activity with feelings of success can help to maintain motivation. Next slide. So this brings us to what to do while staying at home. And I've tried to kind of leave a pretty good, healthy amount of time for questions at the end. So I'll move fairly quickly through these next couple of slides, but some resources that you can access to give you some ideas and some guidance and instruction. A lot of fitness organizations, because they've had to shut down due to COVID-19, are now posting either live exercise classes or recording them and putting them online. This includes a number of cardiac rehabilitation programs. University Health Network in Toronto has had their cardiac college online for quite a while now. Even prior to COVID, University of Ottawa Heart Institute as well has some good online resources. My center as well, the Refit, and we'll again post these in the next couple of slides, has posted some of their gentle fit and stretch and strength classes that I really like for a lot of folks. But before you even start with some of those classes, it may be a good idea to just do a quick scan of what do you have that's readily available that you can use for exercise equipment. Oftentimes somebody will have done physiotherapy at one point in time, and they have kind of one of those stretchy TheraBands, or they bought some dumbbells, they're buried in the basement, or their drying rack for when they do laundry was once a treadmill. So do a quick scan and try to recall for yourself what equipment's readily available that you can use. And another one of my sort of favorite occurrences and talking about realistic goals is when people have fitness equipment at home and they're not quite feeling ready to really start exercising in a regular way yet. They're just still a little bit nervous and uncomfortable. So the goal is to take the clothes off of the treadmill, or to go downstairs and find the exercise tube that they had. So they have the equipment that's more readily available. It's like taking your gym shoes out and putting your gym bag in the car. These little behavioral cues, reminders, can go a long way to helping increase the likelihood that you're going to follow through on a goal that you set for yourself. So doing that kind of a scan. And one thing I'd love to kind of hear a little bit more about is have people been getting creative already with the exercises that you're doing at home? What are the kind of objects or household things that you're using to keep active and to keep fit? Next slide. So again, lots of online resources. The University Health Network out of Toronto has their Cardiac College. It's a very comprehensive resource. Other places often refer to it, and it does come in a variety of languages. So if language is an important concern for you, then they have a number of options available. Next slide. We've included as well, again, as I mentioned, the University of Ottawa Heart Institute. They've got lots of great information, including the behavior change. That's a huge piece. Again, we talk often about this concept of self-efficacy, this notion that you need sort of two sets of skills. One is the actual knowledge of how to do something, and the means to do it. If you don't have a bike, you're probably not going for a bike ride. But then the other thing is having the confidence to do it. That also really increases the likelihood. So some exercises that you can do to help to build up that confidence. Again, I can't speak highly enough about keeping track of your successes and your progress, as well as setting effective goals. Next slide. Karen did a great job talking about self-management, and that's an important piece, being able to sort of monitor your body and assess for any significant changes that might mean that you should modify your physical activities is a very important piece of this equation. So Living with Heart Failure from Heart and Stroke is a fantastic resource. It's a book, but it's also available online. One of my favorite tools when I'm working with home-based patients over the telephone is Living Well with Heart Disease. It's more specifically for coronary artery disease generally, but it has some great exercise diagrams and instructions in chapter 4. Some pretty reasonable diet tips and notes on adjustment. So it's a pretty good resource as well. In terms of what you can do, even going for a walk for some folks in this time, depending on where you are, can be quite a scary experience. If you live in an apartment building where, to get outside, you'd have to go into a crowded elevator, that can represent a significant barrier. The usual tools some folks have of even just doing laps in the hallway of an apartment building or a condo might not be as realistic or comfortable anymore. So it's important to pay attention to what's happening in your local jurisdictions. Public Health Agency of Canada can help give you updates on COVID-19, or pay attention to your local regional health authority or public health officer for updates on how the situation evolves, and adapt accordingly. It's important to use every tool at your disposal to maintain motivation. That includes things like social support, and even that has had to be modified. You know, before we would have been able to maybe call up a friend and go for a walk together or do some exercise. Your gym buddy kind of rings you up and drags you out. A lot of that has changed, but here in Manitoba, some folks are still keeping active outdoors and applying kind of those physical distancing principles to at the same time. And some options as well for sort of virtual delivery too. As I mentioned, the Refit Center's YouTube channel, I do like their Gentle Fit. It's mostly a set of chair-based exercises for folks with any mobility concerns, where just going for a walk or doing some squats might not be a super fun thing for you. But they do give you some options there, and Stretch and Strength is a good kind of resistance class that I usually recommend to people, a good introduction to some basic tubing exercises. So I believe that's it. Hopefully some folks have some questions that we can help answer.
Great, thank you so much, Gord and Karen, for an excellent presentation and some great advice and some tips about cardiac rehab at home and to keep us moving and to keep us healthy. We do have a few questions that have come in. The first one here is, somebody asked about, is it safe for people with heart failure to go for a walk outside, maintaining, of course, the physical distance rules? And I'll open that up to you, both you, Gord, and Karen.
Sure. I'm not an expert in infectious disease, and I would encourage you to follow the guidance of your local public health officers. Definitely if the virus isn't around, then you're not able to get infected. So there's nothing intrinsically dangerous about being outside. It's being in close proximity to folks who are or may be infected. Again, as I mentioned, for anybody who's living in apartment buildings or things like that, it's not just about being outside, but actually getting there. So it's important to know your situation. If you live in a rural area and you're in a detached house and you can just go out for a walk in the backyard, then I don't see any concerns with that, as long as it's not extremely hot or extremely cold. Those environmental stressors are very important to keep an eye on as well, and adapt accordingly, dress appropriately, stay hydrated, take breaks as needed as summer starts to come into the picture.
Great. Do you have anything to add there, Karen, about the distancing and whether it's safe for heart failure?
Yep, I agree with Gord that you do have to really keep that distancing, absolutely important. But to me, a walk is one of the best ways you can try and get active and still have some enjoyment and get that fresh air, so you're not that cooped up inside. So leisurely walk, and I think the same advice that Gord was saying earlier is that, walk so you can talk. If you start to feel short of breath where you can't talk, it's time to slow down and back off. Hum a tune if you want. If it's me, you probably don't want me to hum a tune, but I think it's a very practical way of getting some exercise, infection control, keep that distance. Yeah.
Thank you, Karen and Gord. Mark?
Yeah, so Gord, we had a couple questions, Gord and Karen, regarding lifting heavy weights. If individuals can do squats and deadlifts, as well as the safety. What kind of damage can be done with weightlifting? So as long as I'm not pushing it, I was told I should only be using low weights and nothing too heavy.
Yeah, definitely. So around resistance training, again, it's not super well researched. Nobody's, unfortunately, we don't have any like big international exercise conglomerates who are able to do funding for large exercise studies. So there's not a ton of very good quality evidence around, particularly like heavy and strenuous lifting. It can definitely do some funny things to your blood pressure, for example. Sometimes it can alter things like heart rhythm. So particularly if you get a lot of palpitations, arrhythmias, strongly encourage you to breathe. Any lifting exercise where you have to hold your breath and bear down because it's so strenuous, that kind of like that kind of a thing, I tend to encourage people to avoid. Again, mostly because we know that a little like some resistance training is definitely beneficial, and we want you maintaining the strength of your muscles. But the health benefits of extreme or strenuous lifting, some people do that for enjoyment, but I don't know about kind of its safety record. It's just more uncertain without good quality evidence. So I usually encourage folks to avoid strenuous lifting, but we do want you doing for sure some resistance training, keeping it a little bit lighter, higher repetitions, that kind of a thing. And as well, that's another thing to ask sort of your care team about, if there are any conditions, some connective tissue disorders, disease of the aorta, or aneurysms in places, maybe a reason to avoid strenuous lifting even more explicitly and more absolutely.
Okay, thank you. And the next question was the effects of alcohol and exercise.
Sorry, could you?
Yeah, the question were, what are the effects of alcohol and exercise?
So if it comes to sort of like heart failure, I mean, I would not encourage you to have a couple of beers and then go do a workout. It's the alcohol definitely can impair balance. It can do a lot of really bad things we wouldn't want you doing. Generally, I would not encourage anybody to consume alcohol. Generally, it is a toxin, but yeah, especially with heart failure, there would be potentially a reason to kind of avoid that. Exercise and heart failure generally, again, it helps to improve quality of life. It can makes your muscles more efficient, so it's a little bit less of a workload on your heart. It can help to lower blood pressure, again, keeping the workload on your heart down and helping it do its job and have a better opportunity to kind of heal or slow any disease progression.
Perfect, thank you. So the next question from the audience, and I mean, this is something I participated in as well, or I did, was I participate in a sport that requires brief spurts of intense activity, interspersed with longer periods of low intensity. Is there a particular regimen that would help prepare for this?
Oh, that's an interesting one. There are a couple of things. So it really depends on the sport. Particularly for anybody with AFib, valve replacements, anybody who's on like an anticoagulant regimen, it's particularly important to avoid any like collision or impact activities. So hopefully your care team would have advised you to avoid things like contact hockey or sports like that, and sports where there's like a high risk of severe traumatic falls. Again, use extreme caution with that and talk to your doctor. The burst stuff, high intensity interval training has been kind of a popular topic in cardiac rehab literature these days. Again, there's not a ton of super well established evidence around it, and all the research generally that has been done in supervised cardiac rehab settings. So I wouldn't be encouraging folks to start new interval training all of a sudden. And generally speaking, the benefits seem to be largely the same as moderate intensity exercise. There might be a little bit of edge to hit in terms of slightly improved fitness, but there was one conference I attended where a researcher pointed out that when we talk about high intensity interval training, we do it based on heart rate range. And depending on where you're at with your symptoms and the severity of heart failure, for some folks, getting dressed is effectively high intensity interval training. So if you've been doing physical activity, you're without symptoms, you've talked to your doctor about it, and if it's appropriate, I wouldn't necessarily encourage you to stop your usual exercise regimen, but particularly in an environment where you can't, you're not in a supervised setting. Particularly if you're at risk of severe arrhythmias, ventricular arrhythmias, ICD discharges and things like that, avoidance of things like, being in the water unsupervised might not be a good idea where you can transiently lose consciousness. So the moderate intensity exercise training can kind of help. The sports, again, we haven't done any large trials on these things that would give clear guidance I could recommend to everybody. So unfortunately, I've got to send you back to check in with your care team and ask for specific advice for yourself.
Fair enough. Thank you.
I think this question might be for Karen. So this person asked, they have a CRTD set at rate responsive, so be responsive to the heart rate. Should I have a target heart rate or a heart rate I should not exceed?
So the question I can understand, because you need to look at what is the heart rate that will trigger your defibrillator, because you definitely don't want to go that route. And usually your team will talk to you about what is your setting for your ATP or your VT. I think if you want to do heart rate, that is one way of managing your degree of how hard you are working. Sometimes heart rate is a little bit hard to find. To me, if you go by what Gord had mentioned earlier, that 3 to 5 range, I think that's some good advice on how hard you are working. You can check your pulse, but at the end of the day, if you don't feel well, you need to back off regardless of your pulse. So you may want very specific instructions related to your what rate your ATP may trigger, but otherwise go by how you are feeling. Yeah.
Thank you, Karen. I think this one is definitely related as well. This individual asked, they found it better to go for 2 short walks, but sometimes they have to stop before a hill. It varies by time of day and from day to day. I can talk, but sometimes I have to puff out my breath to get enough air. Is this okay? So either of you, Gord and Karen.
Sure. I definitely think you're kind of on the right track of listening to your body and paying attention to your symptoms. If you're getting to it depends on the steepness of the hill, your own health, talk to your doctor, obviously. But if you're having kind of a bad day and your recreational walk includes a hill, if you're getting to the end of that flat part and you're feeling particularly out of breath, then maybe just do a couple extra laps of the flat part and skip the hill. Like if you're starting to climb the hill and you're getting really out of breath, I don't know that that's going to give you any additional benefit above and beyond just continuing to walk sort of on the flat spots, if that makes any sense.
Mm-hmm.
So another general question, in terms of heart failure, we're often on fluid restrictions. And when exercising, it's always common to reach for that water bottle and say,
yeah.
I need another sip of water. So how do people effectively manage the balance between fluid intake and exercise?
Hopefully carefully. No, it's definitely, and it is important with exercise to sort of stay sufficiently hydrated. Like really, if for anybody that's not tracking kind of your weights on a daily basis, I would really strongly encourage that. Mark it in your calendar or having a log, and knowing kind of how you feel in response to fluid changes. If you're kind of a little bit too dried out, that sometimes exercise is just going to feel really crappy. So some folks will at times kind of, modify their fluid budget throughout the day. So rather than kind of having like a bunch in the morning and then getting rid of it and then exercising, not wanting to take any more fluid, they'll sort of like save a little bit of fluid for a little bit before exercise. You wouldn't want to do too much, again, because that could put undue stress on the heart, but it can be a tricky thing to navigate. Hopefully you have good communication with your care team or your family doc and are able to balance that effectively. Or even chatting about sort of like dosing of any diuretics you may be taking with your nurse practitioner or physician, and when your exercise kind of fits into that picture as well. I don't know if Karen has something to add to that.
No, I think it's part of your overall fluid balance. And so like that may depend on how much you're drinking or water pills. So if there is individual advice, absolutely. These are some tips that patients have given me. They are just tips that if they are on a fluid restriction and they're walking, they actually take a spray bottle with water in it. And it's meant to spray and wet your mouth so that you're not feeling as dry. The other thing they've done is have a little water and do have some ice in it, because sometimes they'll just suck on the ice cube as a way of getting that thirst and that dryness while they're walking without guzzling extra fluid. So those are just some tips that people have shared with me.
Yeah, thank you.
Thank you both. Just one final question before we take a break and pause for get ready for our next session. We do often get a lot of questions about yoga, and I'm sure you're both aware. People with who are on blood pressure medication, who have varying levels of ability to do things. Is yoga safe, or even a chair yoga or something along those lines?
Again, every individual is going to be a little bit different. It'll depend on things like, blood pressures in particular, on how you sort of feel throughout the yoga class and what poses and postures you're doing. Some chair-based yogas are probably a little bit better if you do have lower pressures than anything where you're kind of bending over and standing up all of a sudden is obviously going to create some problems around dizziness, lightheadedness. Otherwise, generally speaking, I kind of like yoga for the most part. Some of the breathing stuff, there's a little bit of resistance training, a little bit of balance training. Have a chair handy if you really struggle with balance and falling is a concern or safety issue, or take on one of those chair-based yoga courses. I generally don't recommend people to go and take on something like a hot yoga class. That can just create all kinds of concerns.
Yes. Any last thoughts, Karen?
No, I agree with what Gord has said. I mean, if you're feeling lightheaded or if standing up quickly, absolutely. And I think just go back to those same things that if you feel short of breath or you find yourself holding your breath to do something, then you've got to back off. It's the holding of your breath and that bearing down that we worry about. And don't look at any activity, whether it's yoga, whether it's opening a window, whether it's lifting 5 pounds. It's really about don't hold your breath and bear down. So avoid those kinds of activities. Yeah.
Remember to breathe. Breathing is important.
Remember to breathe.
Yeah.
If anything from today and everything, yes, remember to breathe. Reinforces what Colleen was talking about as well.
Yeah.
Thank you both so much for participating today and for providing your expertise to our community and for all the work that you do. It's really important work. Thank you so much. We have a couple of more questions, so unfortunately we don't have time, but I might pass them on to you if that's okay.
Sure.
Following the session to see if there's some additional answers we can provide our community. So thank you very much, both of you.